Sleep apnea is the most undiagnosed sleep disorder in the country and affects nearly 20 million Americans. And here to tell us more about sleep apnea and its symptoms is Nancy Raborn of University Hospital. Good morning.
Good morning, Liz.
How are you?
I'm very well, thank you.
Good. Did you have a good vacation?
Excellent.
Good. I'm glad to see you back.
Good to see you.
Let's talk a little bit about what you can tell us about sleep apnea this morning.
Yeah, sleep apnea refers to episodes during sleep in which breathing stops for 10 seconds or longer. And this can occur hundreds of times a night, and in most cases, the one suffering is unaware of the condition.
Wow.
Yes, it's not.
That's amazing. That can happen hundreds of times a night for 10 seconds at a time. That's surprising.
Right, exactly.
Now, you were telling me that there is a link between sleep apnea and heart problems?
Right. There's a very strong link between sleep apnea and heart-related deaths. In fact, those with sleep apnea, untreated, are 5 times more likely to experience heart-related deaths than those without sleep apnea.
Wow. And now this is kind of a scary thing because you say a lot of times you don't even know you have sleep apnea.
Right.
So let's first of all talk about the risk factors. How do you know if you're even at risk for having sleep apnea?
Sure. The risk factors include smoking, obesity, a family history, also abnormalities in the roof of the mouth, tongue, or throat, acid reflux, and alcohol consumption.
Okay, so if you kind of have those risk factors, you need to be looking out for some certain symptoms, I would assume. What are the symptoms that you need to be on the lookout for?
Right. Those with sleep apnea often find themselves awakening with a headache. They feel very tired or sleepy in the morning.
Okay. And
experience excessive daytime sleepiness. The spouse may also notice, that you snore loudly, toss or turn, gasp or choke.
Okay, and that's probably something you wouldn't even notice yourself, obviously. You would need someone there to let you know that's what you're doing.
Right, and for those that live alone, I would encourage that you listen to your body. If you wake up with headaches or you wake up very tired, excessively tired, then that's an indicator that you need to see a doctor.
Okay, great. Now, as far as diagnosis and treatment, where do you start with that?
Well, with the diagnosis, the way they diagnose is they do tests to check the airway. A sleep study may be prescribed. University has its own sleep center that the doctor may refer you to. So, and for the treatment, first of all, you'd want to change your controllable risk factors. For example, the risk factor of smoking or obesity. Stop smoking, lose weight, go join a gym, and of course, you can't do anything about heredity, and then, the primary treatment option, though, for sleep apnea is the use of CPAP in most cases, and that stands for continuous positive airway pressure. Basically, it's just a device that's put over the face and the head, and it puts the pressure into the nose significant enough to keep the airways open at night and assist with breathing. Initially, it can be an adjustment for most people, but those that have started CPAP and use it as directed have found that they have more energy throughout the day. They can function at a much higher level throughout the day. So it is an adjustment, but it would ensure a healthier you and may very well save your life.
Well, I know it seems like every time we talk about something, I have a relative that has it, but my uncle does have sleep apnea, and he does sleep with that machine. My aunt says it makes a world of difference in her sleep because he's no longer snoring or tossing and turning. And so she's sleeping better, he's sleeping better, and everyone's better.
And he's no longer on the couch.
No, exactly. In bed with the mask and sleeping just fine. So if you have any questions about sleep apnea or any other things you'd like to ask a nurse at University Hospital, you can call their hotline. Can you give us that number?
Sure, 706-737-8423 or 1-800-476-7378.
All right, perfect. Well, thank you, Nancy.
Thank you, Liz.
Pleasure to see you as always.
Thank you. Great to see you.
See you again next week, okay?
Thank you.
Thanks. Well, Augusta's big